Have you been slaving away working from home at the computer and now you're getting wrist pain, tingling and numbness, and loss of sensation in your fingertips? Well, you could be dealing with carpal tunnel syndrome. Carpal tunnel syndrome is a condition that affects millions of people worldwide. And I'm sure it's affecting even more people now since the pandemic, with everyone working from home and spending hours and hours in front of their computers and on their phones. It's a painful condition that affects both your hand and your wrist due to the pinching of a nerve called the median nerve passing through this portion of your wrist called the carpal tunnel, hence carpal tunnel syndrome. So what are some symptoms of this carpal tunnel syndrome? Generally, you get numbness and tingling coming through your thumb, index, middle, and half of your ring finger. So the first 3.5 fingers. And you can also get some weakness and atrophy, so muscle wasting of this portion of your thumb, so the thenar eminence. So you might be asking, why is this happening to my hand? Well, you have to think about what structures are passing through this carpal tunnel. This carpal tunnel itself is not very big, and there's so many structures that pass through it, including your median nerve, but also the muscles that control flexion of your fingers. So what are some common causes of inflammation or wrist pain and obstruction of the median nerve in our carpal tunnel? Again, there are several causes. Most commonly we see it's because of repeated wrist movement or hand movement, such as typing on a keyboard and clicking on the mouse and anything that requires a lot of gripping. So I see this a lot with people who are working from home now, those who require to use their hands a lot, like carpenters or mechanics or other people who are in the trades industries. So a lot of the time we see it's because of the tension buildup and the repetitive use of these muscles that are irritating the nerve inside that carpal tunnel area. And of course, it's important to understand your health history because there are other conditions that might lead to the increased likelihood of getting carpal tunnel, such as pregnancy and the water retention and swelling that happen from pregnancy, diabetes, obesity, and arthritis. So let's talk about how I would test this in clinic and how you can do this yourself at home pretty easily. So there are a couple tests that we generally do in the physiotherapy clinic to help test for carpal tunnel. The first one is called the Tinel's test. Now basically what the Tinel's test is what we're trying to do is we're trying to elicit that tingling and numbness by tapping on the area of the nerve where it might be irritated. So in our case here, we're going to be tapping right on the carpal tunnel or on the wrist. So if I were to show you on my left hand here, again, the carpal tunnel passes right through this area here. So by taking my hand, making a little bit of a hook, and just tapping firmly right on that area of the wrist. And what you would feel, if it's a positive test, you would feel this electrical feeling kind of shooting and zapping into the thumb, index, middle, and half of your ring finger, and again into your palm as well. So most of these symptoms will appear on the palm side of your hand. The next very common test that I would use to test carpal tunnel syndrome is something called the Phalen's test. And basically the Phalen's test is me just taking my hand, pushing the back of the hands together at a 90-degree motion and holding this position here for about 30 to 60 seconds. And basically what you're trying to look for again is the reproduction of symptoms. So tingling, numbness, loss of sensation into the fingers and the palm of the hand. And this, if positive, may be indication that you are dealing with carpal tunnel syndrome. So generally what we like to do is we like to do a battery of tests. So not only one test, but several tests to see if there are multiple that are positive, and that would be a good indication that we are dealing with something likely like carpal tunnel syndrome. So now we know how to test for carpal tunnel syndrome. What are the treatments? Now again, going back to what we were talking about at first, we want to make sure that we know what the cause is. So it could be something as simple as using our hands too much or our wrists too much. So adjusting for positioning, posture, or taking more frequent rest breaks would be important to identify the cause and reduction of the irritating factors of carpal tunnel. And occasionally, depending on the severity of your carpal tunnel, we might recommend wearing a wrist brace or a splint to immobilize your wrist to reduce the amount of irritation on the nerve. I would even recommend sometimes talking to your doctor and seeing if there's any medication that can help to reduce some of the inflammation happening through the wrist. And in the most severe of cases, occasionally the doctor might even recommend a cortisone injection into the wrist to help reduce some of the irritation and inflammation on the nerve. Now, again, this is generally something that is indicated after a failed attempt at conservative management. So resting, removing aggravating factors, and exercises from physiotherapy. Now, on the topic of exercises, what would I recommend? Generally speaking, before we even think about that, we want to make sure that all exercises are relatively pain-free and not irritating. So they should not be painful while you're doing them, and they should not flare up your symptoms too much during or after your exercises. So one of the first exercises I would recommend would be to stretch out the muscles that connect into your wrist and your fingers. So the best way to do this would be to put your palm down. Alternatively, you can do it upwards. I like doing it palm down, taking my other hand and pulling my fingers gently backwards to help stretch out the flexors of my hand. Again, these exercises should not be flaring up any of your symptoms, and they should be gentle and pain-free. Holding this for about 30 seconds to 60 seconds will be ideal. And similar to the first one, the second exercise I will work on is just to generally release some of the tension through the back of my wrist, putting that palm down and pushing down and stretching the back of my wrist. Now this time I'm going to be stretching through the back of the wrist into the extensor muscles. Again, 30 seconds to 60 seconds, pain-free stretching. And another exercise that I would generally recommend for my patients is to help gently massage the forearms. So if we look at the forearms here, the first 2/3 of the arm is where most of the muscle bulk comes from, and that's where I would generally recommend to massage gently with your hand. You can use cream, you can use a ball, or you can use another tool, but gently loosening up the muscles through your forearm where your wrist flexors and finger flexors come through. Okay, so over here, right through here to about 2/3 of the way down. That's where most of the muscle belly comes through. And you do nice long stroking motions. Again, these exercises should not be irritating for the carpal tunnel, should not be painful, and you can do these as long and as often as you want to. And last but not least, one of the more important exercises is to get that nerve mobilized, and basically that just means to get the nerve moving back and forth to clear out the junk and reduce some of the irritation factors that might be compressing on the nerve. So we do something called a nerve glide exercise. For the median nerve, what I like to teach would be something that looks like this. Take your hand, put it up like you're holding up a tray, and putting a gentle stretch through that forearm. Now what we're going to do as we hold this position, we're going to slowly extend our arm downwards, and at the same time we're going to rotate our neck. And we're going to do that back and forth, so bring the tray back up, looking forward, and again looking down, bring that tray forward, looking towards the same side as our hand. Now nice, smooth, gentle motions back and forth, going for about 1 minute or so. And again, these should not increase your symptoms. If anything, it should help you reduce a little bit of that tingling and discomfort through your wrist and through your hand. Well, that's it guys. I hope you found that helpful or useful, and if you did, consider subscribing to this channel because I'll be posting more similar content like this. Until next time, remember, I got your back.